Hey moms and dads, this video is if you've been looking into a pediatric chiropractor for your kiddo and you want to make the best choice possible. I know your kiddo is the most precious thing in the world to you. And so in this video, I'm going to share 5 things to be looking for to make sure you can make that best choice. Now, one of the reasons I'm making this video is, yes, if you are local to us in Minneapolis, St. Paul, the Twin Cities, I'd love for you to come see our office. But if you're watching this from somewhere else, you might be looking in your area, and we've had a lot of moms and dads reach out to us from other cities. Just 2 months ago, there was a mom who scheduled an appointment in our office from Houston, Texas, to see her daughter because she felt we could help, and she didn't know who to go in her area. As I'll explain in step number 5, being able to see your chiropractor regularly is super important. So we were fortunately able to find someone in her area. Just last week, I posted a video and a mom from Hawaii reached out to see if we knew anyone over there. So step 1 is if you are looking for your kiddo, make sure your chiropractor has advanced training in pediatrics. It's one thing to be talking to a chiropractor and they say, oh yeah, we see kids. But when you go to their office, you don't really see many kids around, or you see signs for slip disc and back pain or car accidents. And quite frankly, the training you get to help some acute pain is way different than the training you get to help kiddos in pediatrics. So I know in our office, both myself and Dr. Chelsea have each had well over 150 hours of additional pediatric training to really hone in and specialize in that area. Step 2 is not only have they had training in kids, but they actually have a high level of clinical experience in helping kids. I remember some of my early pediatric classes that I took, and in class we'd be practicing on a doll, and suddenly I take that to the office, and now I've got an infant or a toddler crawling and squirming around. It was a way different ballgame. So actually having practice with kids to know how to read their bodies and give them an amazing adjustment even when they don't want to sit still, or maybe they're a little anxious, maybe they're too young to pay attention. All those things are variables that you want to make sure your chiropractor has experience with. Number 3, do they incorporate advanced neurologically based examinations? It's one thing, again, to talk to an adult who fell off a ladder and something got out of place and you move it back to help with their pain. But it's another thing if your kiddo is struggling with autism, with anxiety, ADHD, sensory processing, immune system that's not working well, if they're missing milestones, if they're a colicky, refluxy baby, all those things, we're looking at the nervous system as the foundation to get your kiddo better. And in our office, we use an advanced scanning technology called the Insight subluxation station. And that Insight technology allows us to get an insight into your child's nervous system to see truly what's going on, where stress might be stuck on inside their body, so we know what it takes to get them better. So if your chiropractor has that scanning technology, it's going to give you as a parent a lot more feedback on what's going on, what the problem is, and then how they're improving and getting better. And number 4 then, from the exam and looking into the nervous system, you want to make sure your chiropractor can apply different types of adjusting techniques. If different things are going on with your kiddo, they might need different techniques at different phases of care. So that's another thing that we're taking into account is what was your kiddo's birth history? Was it a C-section? Was it forceps? Was it suction? Was it a long, long labor and delivery? Was baby stuck? Did baby come out really fast? All those things early on make a big influence. What other stressors have they had in their life that are impacting how their nervous system is responding? And as the chiropractor then, it gives us feedback on what style adjusting to do to help unwind their nervous system to get them out of that stuck in stress mode. And then the last one, number 5, is make sure you're seeing a chiropractor who gives a customized care plan with both enough frequency and enough duration. This was a challenge that I experienced a lot early on in practice is I thought, well, they're just kids. Maybe they don't need as much care as an adult because they're little. And what we're seeing nowadays with the more fast-paced society, with the more stress that we're under, is that kids we see, especially depending on how they got brought into the world, sometimes need more care than we recommend for some of the adults that we see. And so number 1 is we want to make sure we're recommending enough frequency, because if care gets spaced out too far, maybe they get checked once a week or once or twice a month, now there's not enough momentum to really break that old stress pattern. And then secondly, the duration of care means once you do get that momentum going, if you take your foot off the gas too quick and start to slow down, then you can lose that momentum before the deep neurological changes have had a chance to take place. This was the other challenge that I experienced for myself early in practice, is we saw, oh, the symptoms are starting to go away, let's cut back on care. And what would happen is now a growth spurt, fall on the playground, a sporting event, a test, a tooth coming through, an immune system challenge would all of a sudden bring stress back into the nervous system and start kind of tipping us back to where we started because we didn't have enough time to really make those deep changes. So make sure your chiropractor gives your kiddo enough frequency and enough duration to make long and lasting changes and really go deep with their healing. So if that's something you have more questions on, definitely reach out to our office. If you are in a place outside the Twin Cities, shoot us a message, and we're happy to share resources and databases that we know of other chiropractors who fall under these categories so you can get the best care for your family and your kiddo as well. Talk to you soon.